Most people check their blood pressure, see two numbers, and have no idea which one matters more. Your doctor stares at that little screen, nods slowly, and you're just hoping the silence means you're fine. But here's the truth. One of those numbers could be silently destroying your heart, kidneys, and brain. Welcome back to BioWell Hub, where we break down the science of your body in ways that actually make sense. Today, we're settling one of the most misunderstood debates in cardiovascular health: systolic versus diastolic blood pressure. Which one is more dangerous? Which one should you be watching more closely? And what do those two numbers actually mean for how long and how well you live? Stay with me. Every time your heart beats, it goes through two distinct phases. First, it contracts and pushes blood out. That moment of contraction, that push, is measured by the top number in your blood pressure reading. That is your systolic pressure. Then your heart relaxes between beats, refilling with blood before the next contraction. During that resting phase, your arteries still maintain a baseline level of pressure. That is your diastolic pressure, the bottom number. A normal reading is around 120/80. The 120 is systolic. The 80 is diastolic. For decades, doctors focused heavily on diastolic pressure. The thinking was that constant baseline pressure was the real wear and tear number. If your diastolic was high, your arteries never truly got a break. They were under stress, even when your heart was resting. And that constant pressure was believed to be the more dangerous one, because it never let up. But then, something shifted in the research. Large-scale studies, including the famous Framingham Heart Study, started revealing a more complicated picture. Scientists noticed that as people aged, diastolic pressure tended to plateau or even drop, while systolic pressure kept climbing. And it was those rising systolic numbers that correlated most strongly with heart attacks, strokes, kidney failure, and early death. Here is why elevated systolic pressure is so damaging. When your heart contracts and fires blood with excessive force, it puts enormous stress on vessel walls. Over time, that repeated hammering causes tiny tears and damage in the arterial lining. The body tries to repair these areas, but cholesterol and inflammatory cells get involved. And this is how plaques begin to form. These plaques narrow the arteries, make them stiffer, and dramatically increase the risk of a clot breaking off. That clot can travel to the brain or the heart. That is a stroke. That is a heart attack. An elevated systolic pressure accelerates this entire process. Isolated systolic hypertension, where the top number is high, but the bottom number is normal, is now recognized as one of the most dangerous forms, especially in people over the age of 50. In fact, the American Heart Association classifies high blood pressure as anything at or above 130 systolic or 80 diastolic. But the systolic threshold gets particular attention in older adults because the data consistently shows it as the stronger predictor of cardiovascular events. Now, does this mean diastolic pressure is irrelevant? Absolutely not. High diastolic pressure is still a serious concern, particularly in younger adults. If you are in your 30s or 40s and your diastolic number is consistently above 90, that is a major red flag. High diastolic in younger people is strongly associated with increased risk of heart failure and kidney damage over time. The heart is working against resistance during its rest phase, and this extra workload causes the heart muscle to thicken and stiffen. A thickened heart muscle is a less efficient heart, and over years, this leads to heart failure. There is also a growing area of research around what happens when diastolic pressure drops too low. This is called low diastolic hypotension, and it is particularly concerning in elderly patients being treated for high systolic pressure. If the diastolic falls below 60, while systolic is being aggressively managed, the coronary arteries may not receive adequate blood flow. This can actually increase the risk of a cardiac event even while you are trying to protect yourself. It is a delicate balance, and it is one of the reasons blood pressure management should always involve a qualified physician. So, where does this leave us? If you are under 50, pay close attention to both numbers, but be particularly vigilant about a rising diastolic. If you are over 50, systolic pressure becomes your primary concern and is a more reliable indicator of your cardiovascular risk. At any age, a blood pressure reading of 140/90 or higher means you need to be in a serious conversation with your doctor. The best thing you can do regardless of your age is monitor your blood pressure regularly. Reduce sodium intake, exercise consistently, manage your weight, limit alcohol, and if prescribed medication, take it exactly as directed. These are not suggestions. These are the interventions the data supports. Your blood pressure is not just a number. It is a live report from your cardiovascular system, and both digits are trying to tell you something. The key is knowing how to listen. If you found this video helpful, hit that like button and subscribe to BioWell Hub, because we cover the health topics that genuinely matter for your long-term well-being. Share this with someone who checks their blood pressure but never really understood what they were looking at. And drop a comment below. Which number has your doctor been watching more closely? We would love to hear from you. See you in the next one.